Good morning. Happy New Year. How are you, good people? How are you doing? How was your Christmas? How was your holiday? How was everything? And how is it shaping for the new year? I'm glad to be here with you. I will allow another 5 minutes so that many of us can get in, and then we can have a conversation to open the new year. Happy New Year. Good morning everybody. Good morning Lewis. Good morning Jockey. Good morning Guru. Guru, good morning and happy new year. Regine Cherotich, good morning. Wangare, good morning. Good morning Kiprop, and good morning Maurice. Good morning Edward. Clinton, my good friend, good morning. Alex Chebun, good morning. Yes, it's going on great, Guru. Thanks for asking how I'm doing. Yes, Joe Chinga, good morning. Thank you, and blessed and lovely one too. Mzenga, karibu sana. Good morning from Loa Lolim. What a name. Noel Muriuki, good morning and thanks for watching. Thanks for coming live with me. Edward, yes, I was at Correctional Services. Good morning. This year has begun well for you, and it has begun well for me too. Good morning, Bogo Apollo. Good morning, Leonard Kipsang. Happy New Year, Wanjohi, Emmanuel, Monyaka, Steve Owiti, thanks for joining. Chelal, asante sana. Thank you. Eunice, Yusufu, Purity Wakungwi. Yes, and thank you, and we'll continue doing a lot more with the National Public Health Labs. It is my focus for this year, and I am happy that you're there. Good morning, Barno, Rotich, Nehemiah, Ngure, Mumboi, Albert, thank you. Thank you, Monyaka. Thank you, Masharia. Thank you, Meli. Yes, you're watching from Nandi Hills. Oh, I'm proud of you too. Thank you very much. Good morning, everybody. I am so happy to see you back fair and square. And most importantly, is the way the Lord God has taken care of us. Tulirukisha mwaka vizuri, so I'm very happy that I can see most of you are back to work, and those who are not back, I'm sure they are preparing to go back to work. This week is back to school week, but remember, even with back to school, you have to take care of your health, and you have to take care of the health of your loved ones. That is why it is very important, before you take your child back to school, ensure that they have registered to the Social Health Authority, and ensure that they are enjoying the benefits while at school. Good morning, Mwanza. Good morning, Julia. Good morning, Geoffrey. Good morning. Yes, SHI is working. In fact, we are not at the stage of wondering whether it is working or not. We are at the stage of thinking, how do we improve on the already existing structure that is there, because we are not going back to NHIF really. We are here with SHI, and yes, we are going to improve it on a day-to-day basis. Now, one thing that people have been asking themselves is there's a day His Excellency introduced the word Taifa Care. And everybody started asking, what is this Taifa Care? Is it SHA which has been changed to Taifa Care? Or what is just happening? And I think it is very important to really discuss some of the concerns that the members of the public have, and who else should, apart from us who are in a position to understand what exactly is happening. Good morning from Kericho County, Kapianga. I think, anyway, thank you very much. Continue giving me ideas, continue writing on the wall, or even inboxing me some of the things that are happening across the country, some of the things that are happening near you, and the improvement that should be done. Give proposals are welcome in anything around touching on the public. Public health is health, and we must all be in it so that we can all succeed together. Now, Taifa Care. Really, this is an advanced health management information system. When you talk about the different parts that constitute to healthcare, then all of them put together is what Taifa Care is all about. The interrelatability of the different functionalities within the healthcare system, and one of it being the Afya Yangu health management information system. We have the electronic medical record system. We have the enterprise resource planning system. We have the Health Pro. We have employer portal. We have health information exchange system. We have Afya Link. We have e-learning. We have consent management system, telemedicine, ambulance management system, name it. Anything that you may want to know that is happening around healthcare, then it is all put together into Taifa Care. That is what we are calling Taifa Care. And SHA is just one of it, because Taifa Care integrates with national healthcare initiatives like Social Health Authority. So Social Health Authority is just a component within Taifa Care to provide real-time insights for healthcare practitioners, administrators, county officials, and policymakers. And by fostering all this, you will see a lot of collaboration, resource optimization, and transparency with Taifa Care. Because even if, and this aims to improve the patient's outcome, at the end of the day, we are really thinking about the patient, because that is the client, and that is the person we should first, tunapea kipaumbele, what we may say in Swahili, anapewa kipaumbele. And this will strengthen the Kenya's healthcare system. Universal health coverage has never worked in Kenya, and it has failed in very many countries across the world, across the globe. In Kenya, it must work. Lazima ifanye kazi, and it is because we are there to ensure these systems are working, and to ensure that we are giving the people of this country the available, acceptable, affordable, and accessible quality healthcare. That is the ultimate goal, that anybody seeking healthcare services in this country can access it without struggle, can be able to, it must be available for everybody. And that's why we want to ensure that enrollment to the Social Health Authority is by everybody in this country, not to miss the services that are being offered in the country. And of course, affordability. that is why I will pay what I can afford, going by my salary that is paid to me by the government, and you will pay going by the gross that you get at any given time. So I'm sure we have understood what Taifa Care is and what does it do to probably the patients. And you will see with Afya Yangu, for instance, the Afya Yangu, you will see the simplified registration, faster patient boarding, and reduced waiting time. Because if you're able to register in good time, you're able to register quickly, then you're also there's going to be reduced waiting time, and especially when you seek services, health services at any given time. And there's continuity of care with Taifa Care for the patient, because we have a centralized electronic health records which will ensure seamless flow of follow-ups across facilities. When you go to any facility, there's interrelatability of data, and because of that centralization, you can find your data at any other facility with a lot of ease. There's equally accessibility of services in terms of we can enable this enabling of online appointments, booking and reminders, improving convenience at all times, that you don't have to go to a facility physically, but you may have to book your appointment online. And the transparency of billing is really, really good to allowance to clear the accurate invoicing of integrated insurance invoices. Remember, during NHIF, there was a lot of gambling. You know, we didn't, sometimes you may not, you take a long time to verify even a simple invoice, you know, but right now it is going to offer, this Taifa Care will offer integrated information that will allow for clear and accurate invoicing within the system. At the end of the day, we want to see improved outcomes, you know, enable personalized treatment and early detection of illnesses. Remember, I have kept on talking about screening. And this year, if you have never gone to a health facility for screening, please ensure you do. I want to remind all the ladies that this is the Cervical Cancer Awareness Month. We'll talk about cancer, the cervical cancer. We will increase the screening at the facilities, and we would really want to see the ladies coming out and going to the facilities to get screened. Remember, this screening is equally part of the Social Health Authority. Please, ladies, go and get screened for cervical cancer. Let's talk about efficiency, ladies and gentlemen, because Taifa Care will enhance efficiency in terms of patient experiences through streamlined and efficient healthcare services. This is all you want. You want, when you book an appointment, that it is followed, and when it is done, you get efficient services and service delivery, all the way from the registration point to any other point that you go to in that particular facility. Ladies and gentlemen, you know, for the medical practitioners, Taifa Care is giving them comprehensive data, patient data. Not every time you will go and start repeating your story from where you started. Once you get to a facility, the medical practitioner is able to look into the system and see what is the patient history is. Therefore, Taifa Care allows practitioners to access to the centralized health records for informed decision making. What other better thing can we do? Automated workflows, which reduces paperwork, allowing more time for patient care. Remember, even you, when you were young, you must have had an exercise book that whenever you went to a health facility, you had to produce either a card or an exercise book where the doctor wrote last. That is going to be a thing of the past. Just present yourself to the facility and get access to the services. Again, the collaboration of tools within departments, which will enhance communication, maybe from the labs to where the doctor is or any other practitioner is working from. There's going to be that interdepartmental communication and referrals. Performance monitoring again, which will help us track the clinical performance and identify areas of improvement. And this is to the medical practitioners. This will enhance the overall delivery within, which will empower the medical professionals with tools and data to enhance the service delivery in our facilities. So what are the benefits of Taifa Care to a health facility? First is optimization of resource allocation, real-time data on bed occupancy, staff schedules, and inventory, allowing better resource allocation, improved financial management through automated billing, claims, and expense tracking, operational efficiency, again, which allows streamlined workflows for staff management and hospital maintenance. We have performance dashboards that you're able to see the insights into facility performance at any given time, and service delivery metrics. There's also compliance in terms of tracking that ensures adherence to health regulations and standards. Those are some of the benefits that you will see with Taifa Care and at the health facility. The counties equally. Remember, health is a devolved function. There are benefits that come with it and actionable insights for effective healthcare governance through data-driven resource allocation. We are able to have a fair distribution of funding, equipment, and personnel to the health facilities at the county level. Disease surveillance again, facilities monitoring and response to public health threats at any given time, because you have data, you have quality data that can guide you on what to do next. And this, of course, improved facilities, improved service delivery at the facility level, because we have insights into facility level challenges for targeted interventions. It is important to note that when you are data driven and you have insights at facility level, you're able to also have targeted interventions. You're not doing guesswork at any given time. Transparency. Remember, there's enhancement of accountability. When there's data, even the members of public are able to query and question, why do we not have commodities at this facility at this given time, while we know that this is the data, or why did we get excess or less of it? Because we have real-time reporting of healthcare facilities. Then there's the progress reporting and tracking, which monitors county health facilities, county health goals, and performance metrics. This really, you see, Taifa Care is overall giving us a holistic way of approaching issues, both as the national government and equally at the county government. The national government is not left behind because we have a role to play. And the Constitution allows us, really gives us the mandate to create policies and do training for our workforce. Therefore, we are able to develop policy and access through the access to the aggregated data for crafting evidence-based policies. It is important to note, while we are policymakers, you need to have information that is real time, so that you're able to guide on which direction to take. Also, the universal health coverage. We must be able to track the progress towards the healthcare equity goals. The epidemic control, which enables real-time disease tracking and national level health surveillance. It is very important. Budget optimization. While we go to Parliament, we are able to really pick on targeted budgetary interventions that will cascade all down to the bottom of the pyramid and to the county level. Then we have international reporting many a times, and especially even when we have we have outbreaks, we are required to do regular reporting. This is to also support compliance with with the global health requirements like the SDGs, the Sustainable Development Goals, reporting that a given time. Ladies and gentlemen, I have taken time to really look into Taifa Care, and I wanted to break it down so that people can know exactly what is this Taifa Care. And you can see this is not just about SHI, but it is broadly intervening on many issues to do with commodities, issues to do with human resource, issues to do with infrastructure, issues to deal with the patients, the patient quality assurance in terms of services. And this is also broadening up to donors and sponsors. When we have impact assessment through data on the health outcomes of a particular program that is funded by a donor, we can equally use have utilization reports that tracks on how the resources, equipment, and funds are being used within facilities. We can also have transparency in terms of detailed reporting, and which ensures trust and credibility with stakeholders, because it's not just about getting money from either Global Fund, AMREF, or any other stakeholder who we work very closely with. Then there's also collaboration, a lot of collaboration opportunities. When you have clean reports, you know, you've done your audits, you've been able to do impact assessment, you have utilization reports, then it shows transparency, and you're also able to attract more opportunities for collaboration within other stakeholders that are that may be willing to work with the health sector. Therefore, we are able to identify gaps and the unmet needs within the sector for further investment. And the whole of this is about scalable solutions, which supports pilot programs and scalable activities, initiatives for greater achievement. The employers have a benefit from Taifa Care, and one of it is efficient insurance claims. When you offer services and you've been contracted through SHI, and there's integration, this reduces a lot of delays and errors in claim processing. You have seen right now SHI is actually doing their claims earlier than what used to happen in NHIF. Most facilities are being paid on a monthly basis once the claims have been verified, because we have to verify really whether this is real or it's imagined. Therefore, this to the employers is a game changer. Again, there is reduced health care costs. SHI provides affordable healthcare coverage, which reduces the financial burden of every employer funded medical benefits. Again, there is improvement to the access of healthcare into the healthcare because of the comprehensive coverage for inpatient, outpatient, maternity, chronic illnesses, treatment, and specialized services. which ensures that there is holistic employee care. Again, there is better workforce productivity, because if you have covered your employees, then why else would they care when they know they can be treated or they can access the services that other people are accessing? The quick access to medical attention ensures the employees recover faster and they are able to return to work as fast as possible. Ladies and gentlemen, as I conclude, I want to assure you that the Ministry of Health is on top of the game. And universal health coverage has to work for us to have an acceptable, accessible, available, and affordable quality health care. Taifa Care revolutionizes the health management information system by addressing the needs of diverse stakeholders, by streamlining workflows, providing actionable data, and promoting transparency. And Taifa Care strengthens Kenya's health system, ensuring equitable and efficient health care delivery in this country. Asanteni sana in that regard. I thought it is good that I come and have a discussion around this. I hope we are still continuing to register to the Social Health Authority, which is part of Taifa Care. And I want to really confirm to the people of this country that let us take a day at a time. If there is something that has not been fixed, then we must look into it and fix it, because it is for the benefit of all of us. Remember, registration to the Social Health Authority is very simple, very easy. The *147 hash. Should you be coming from a region, the community health promoters are out there, and I am my second part of this presentation today. It's gonna be a little longer today because I have not been here for around 1 month, and this information needs to get to you. Now, primary care fund is supposed to take care of our lowest level of the facilities, because our primary care fund provides initial interaction with patients, and largely outpatient. When you go to the health facility, that is the dispensary and health center, this is fully funded by the government. It is through the exchequer. So the government has set aside funds that are going directly to these facilities to take care of the mwananchi. This is available in level 2, level 3, and level 4. Level 2 is what we call the dispensary, and mostly, majorly, you will find a nurse in that facility. More so, you can also find a clinical officer. Then we also have level 3, which is the health center. We equally have level 4, which is the start of the secondary facility. But we included it because there are many level 4s, and there are many people who may not be near a level 2 facility at this given time. This is accessible to all registered members. So please register. Again, patients who require additional or specialized treatment are referred to level 4, 5, and 6. So currently, our level 4, which is our sub-county facility, mostly sub-county facilities, our level 4 is giving services to the primary care and equally to the secondary services. Again, this will cover both in private and public facilities. The Social Health Insurance Fund, which is funded at 2.75 from employees through monthly payroll deduction, is also and also 2.75 from the informal sector through means testing, and with a minimum of 300 per month, It is available on referral, and it is accessible to fully paid up members, and the government and counties pay for indigents. The service is based on approved benefit package and tariffs. Ladies and gentlemen, I know I cannot wind up if I have not mentioned about touching issues that have been there. I know there is a virus which people have been talking about, which has been in China. I want to encourage everybody that some of these issues are not really new, and unlike COVID or influenza or any other, there are areas of mitigation of how to mitigate some of these issues that are coming up. Hand hygiene. I keep saying wash your hands. Wash your hands thoroughly with water and soap. Ensure you avoid touching other areas and continue feeding without cleaning yourself again. It is important that whenever you're sick, please stay at home. Important that the surfaces that you touch, you're able to clean them. Important that you observe respiratory etiquette. When we talk about respiratory etiquette, cover your mouth when you're coughing or when you're sneezing with a tissue or an elbow, or so that the droplets do not get to other people. And ensure you're vaccinated at any given time that you feel unwell or as prescribed by the doctor. But there's no sound for alarm, and we should continue with our normal way of seeking services. Then there is Mpox, which has been with us for some time now. Still to confirm that confirmed Mpox cases in the country, the recoveries are at 90%. So this is a disease that it is treatable. The National Public Health Labs, we have 367 samples, 31 which are positive and 336 which are negative. A total of 221 contacts have been listed, 204 have been followed up for 21 days, and 9 contacts have tested positive for Mpox, and 8 are currently on follow-up. In the last 24 hours, 17,842 travelers have been screened at the POEs, and we are continuing with risk communication messages across board to ensure that we are able to take care of our members of the public. I don't know what else I would speak about today, because this is the start of the year. I am seeing so many UHC staff are tagging me. They are tagging me and saying that they have been left alone. Now, the universal health coverage staff, I have always, and I will still, I'll continue telling any human resource practitioner, health practitioner, that the government cannot leave you alone unless if you want to let yourself down. And patience is something which is a very virtue. You have a contract which was added for 3 years. It is important you use the right channels to deliberate on your issues, because on social media we may not be able to agree. Even if I have a conversation with you here, it is going to be rendered useless, because this is not where we are supposed to be talking. So the UHC staff, I want to encourage you that you follow the right channels to pass your grievances if there are any, and we shall sort them. Currently, I know that you're supposed, or you really would wish to be absorbed, and it is important to really follow it up so that you we don't bring issues of such magnitude on social media. Today I said we are discussing about Taifa Care, and we wanted to explain to the members of public what exactly Taifa Care is, and also encourage the members of public that we continue registering to the Social Health Authority. Should you have forgotten what are the benefits of the Social Health Authority or how to register, I have reminded everybody that it is star 147 hash. And secondly, I have said many times, do not register alone. Register your household. If you're a man, you register, and you register your dependents, your wife and children. If the breadwinner of the house again is the woman, make sure you register your husband and your children as dependents. Secondly, SHI is going to take care of all the children in this country, starting from the children who are at the lowest level, the chair, the nursery school, all the way to high school. Unlike NHIF that only used to cater for children who are in primary school, in secondary school, sorry. And Linda Mama is also going to take care of our pregnant mothers who are looking forward to have their gifts. It is important to note that the mothers are going to be taken care of right from prenatal care to during delivery and after delivery. And I am aware that many mothers have benefited through Linda Mama program, which has been enhanced. Our chronic illnesses, dialysis, you have seen the noise has gone down. SHI is working. Kidney transplant, we have seen in Kenyatta, it is working. And we have seen even post operation that it has taken care of the patients. So really, good people, this is a game changer for our country. And we want everybody to have an affordable health care so that we are able to move this country forward. And we are also able to take care of our economy when we are healthy. I want to finally talk about our group, which is the Community Health Promoter. And this group of people, and I want to reiterate that the Community Health Promoter is the individual at the community level, and their work is to move from household to household. Their work is to ensure they check your blood pressure, they check your blood sugar, apologies, call was coming through. So the community health promoters have been able to do quite a good job. First, I want to confirm that the national government released funds meant for community health promoters up to the last coin. And should there be anybody who never received their money, that is one who we gave a phone, one who we gave a kit, and has been working in the community, please ensure you report to your community health assistants, to your chair, so that, or to the county government, so that your names are able to be rectified, or we are able to know who has missed, because we have paid everybody up to December and we are ready to pay January. I only want to encourage you to keep registering people to SHI. Ensure you finish your 100 households every month. Visit your 100 households every month and ensure you do a close check on the individuals who you have already seen. All counties are now using the electronic health information system for routine community health services with the community health promoters. We have been able to register 8.5 million households in this country through ICHIS, against a target of 12.5 million households. This year, we must get 100% registration of households across the country. We have been able to visit 7.1 million households, revisit. So we have visited 8.5 million, and we have revisited 7.4 million households. 24 million people have been screened for diabetes. And out of the 24 who have been screened for diabetes, 284,000 people have been referred to a health facility for further assessment. 16 million people have been screened for hypertension, and have, out of these 616 people have been referred to a health facility for further assessment. What does this mean? We have quite a number of people who are walking patients. We're just walking, going to work, but we do not know whether we have any underlying condition with us. And that is where we are getting these numbers. More than 500,000 people who have been referred for further assessment. More than 250,000 people who have been suspected to have diabetes have been told, please go to a health facility and let the health practitioner advise you further on what to do. 340,000 pregnant women have been identified. So in the routine work of the community health promoter, they came across 340,000 women who are pregnant, and they identified them, and 133,000 pregnant women were advised, or they were linked to a health facility for their antenatal care. Children under the age of 5 years, over 6 million children have been assessed for common childhood illnesses, including malnutrition, diarrhea, malaria, pneumonia. Our community health promoters have been trained intensively to assess common childhood ailments. And once they are able to assess cases of malaria, pneumonia, cases of malnutrition, they link them to a facility so that they are able to be assessed further, or they guide them. If it's malnutrition, then they advise them on the type of food they need to give to their children so that they are okay. I am happy that we are in a space where we can improve the healthcare system in this country. And truly speaking, we are here so that we can help each other. I'm not doing this simply for myself. I'm doing this because it is the right thing to do. And I am doing this because you equally require this information so that you can influence your circle deliberately, you know, and we are able to give each other the very best that we require. Thank you very much, good people. It's I thought I'll take 30 minutes. It's now 15 minutes past the hour. I have to get back to work, and you equally need to get back to work so that we can grow this country. But remember, your health is your wealth. Have a good day.